Okay, thank you very much. Thank you for having me. So, because I am a global KOL for skin of color and I mainly work with darker skins, it's unique in terms of the nuances of darker skin. So sometimes darker skins can be more reactive or they have particular complaints. So in my this year's presentation, we touched upon newer trends for cosmeceuticals. We discussed what the internet explosion has done. People have more sensitive skin. They've been using many more products. So there's a new terminology called skin kindness, which means that you're kind to your skin. You don't use too many products. You use products which are suited for your skin type. So that's a very new trend of thinking. Newer lightening agents, newer treatments for pigmentation, and as a skin of color specialist, we don't use the word fairness anymore. We use glow, we use radiance, we use inner beauty. The language that we speak to patients is different now. There are many new lightening agents which are for pigmentation, non-hydroquinone lightening agents. So there were lots of new actives we discussed. There are new procedures. There are many home use procedures now for lightening. People are using home use chemical peels. They are using home use derma rollers, home use devices, and many, many new trends which are now available to the Indian and to the global patient. Primary skin types that we treat are Fitzpatrick 3, 4, 5, 6. However, the Fitzpatrick classification is not really applicable for skin of color. So it's really based now on an ITA value. That's a new measurement using the spectrum photometer. But otherwise, just clinically, you can roughly grade a patient into 3, 4, 5, and 6. When you're treating darker skins, we're more prone to pigmentation. So therefore, you need to be careful. You need to be cautious when you're doing, for example, a chemical peel or using a laser. So if you're looking at, let's say, a thumb rule, one needs to be conservative with your approach. Whether it's a chemical peel, we stick to superficial chemical peeling. If you're using lasers, you're more conservative with your settings for lasers so that you don't induce post-inflammatory hyperpigmentation. I think with experience over the years, you kind of formulate your own methodology. But if you had to explain it to a young upcoming dermatologist, what would you say? You would tell them they have to prepare the skin before they do procedures. Your patients need to be using sunscreen. You need to stop aggressive actives before you do any procedures, at least 3 to 5 days before. So I think if I could give you one golden rule, it would be never do a procedure on the first consultation. Make sure that you make your patients use the cosmeceuticals, make sure they're using the sunscreen, you won't have a problem. So one is, of course, establishing contact with your patients. You've got to establish that communication and trust with your patients. You need to advise all patients to use a sunscreen. So everybody asks which is the best sunscreen, and I always say the best sunscreen is the one you're going to use. So the patients need to choose it. As long as they're using it, it's the best because it's going to be applied regularly. If you're doing a chemical peel, be cautious, be conservative on the first treatment. Make sure that you know what you're doing. People get very confused. There's so many assets to choose from, so many companies. So it doesn't mean you have to use all the companies. Just be well versed with 2 or 3. Become an expert with that. That would be my advice. Similarly with lasers, you don't have to have all of the lasers. Just have some which are relevant for you and your practice and be well versed with those. So I follow up in terms of procedures. We follow up immediately, call your patients in. All patients, whatever you do, take photographs so that you have consent and documentation. And you also look at those photographs to really assess if there's some benefit in what you're doing. You take a photo before and after every single time. They do forget, and when they look better, they really forget. So you need to show them where you started, otherwise they'll come in and say there's no improvement. home use devices are going to be a big thing. I think it has changed during COVID. I think everybody has been on social media. Everybody has been ordering online. So I think home use devices, which are things they can do at home, are going to be a big thing. So as a professional dermatologist, yes, they're going to come to us for office professional treatments, but they're also going to be doing something parallel at home. So I think if I really needed to say what the future is, it's for the professional expert dermatologist or plastic surgeon or aesthetic physician. We need to be on our toes. We need to be aware of what's going out there, what patients have access to, so that we offer them something better in the office. So I think patients respond very well if it is advised by a dermatologist. So I think rather than being afraid, I think we need to use it to augment our own practice. So we can use it as an adjunctive therapy. We do professional treatments in the office, and then perhaps they can use certain devices or treatments at home, which will complement or benefit them. So under the supervision or under the guidance of a dermatologist, I think these devices can actually be helpful versus harmful. You know, I think that's very individual. It depends on any doctor, how much time they want to give. But most patients generally tend to see their dermatologist once a month. You know, every 2 weeks, 3 weeks for a treatment, or once a month. So that's how often you would have your patients come in.